Dealing with a cancer diagnosis is a hard and sometimes dark road to walk on. But with today's advancements in integrative cancer treatments, there is light at the end of the tunnel. Here with more is Dr. Dean Silver of Silver Institute for Life Extension Medicine. Good morning, doctor. Good to see you.
Hi, thank you for having me.
You yourself are a former cancer patient. How do you treat cancer?
15 years ago, I treated myself alternatively for lymphoma from the cath lab. So now we do genomic testing. We find out what chemotherapies work, and we find out what natural substances work. We actually look at circulating cancer stem cells, which the New England Journal called a liquid biopsy. So all our treatments are personalized and individualized because everybody's cancer is completely different. The genes are all different. So it's all about genomic testing.
And show us here what we're looking at.
Yeah, all cancers are genetically different, and therefore one chemotherapy does not work for everyone. So the idea now that around the world we are doing testing. So we're taking your cancer, we're mixing it with chemotherapy or vitamin C or curcumin or green tea and seeing how many cancer cells are being killed after 6 days.
So why measure circulating cancer cells?
Circulating cancer stem cells predict remission as well as prognosis. So if I get a patient who's got a lot of them, I know it's going to be tougher to beat her cancer. I know if the level's low, I know this cancer can get better and go away. So it's all about the number of circulating cancer stem cells and how many are positive. So if the metastatic one is positive, if there's different cancer stem cells, we measure 10 or 15 of them. And I can tell by the number that are turned on how serious the disease is.
What is genomic testing?
Genomic testing is actually finding out what genes have been turned on with your cancer.
Okay.
There's always a reason. So traditional medicine doesn't measure that, but I can tell you which genes have been upregulated and which genes are turned on, and and the therapies are aimed at starving the cancer, choking the blood supply, cutting off vital things that the cancers need to grow.
What is IPT?
IPT stands for insulin potentiation therapy.
Okay.
So what I do, we know cancer cells like sugar. We know they like sugar. That's the basis of a PET scan. So what I do, I lower somebody's blood sugar using some insulin. I then give a little blood sugar with a baby dose of chemo, about 1/10 of the dose. And like a smart bomb, it's sucked into the tumor.
Wow.
The Germans are doing it, the Mexicans are doing it, all the Europeans are doing it. They're doing it in South Africa. They're doing it all over the world. And there are my father was my first case. He had a bladder cancer. He was getting the wrong chemo. I gave him insulin potentiation, and he died at 93, 15 years later from Alzheimer's. So this therapy works. So I'm not saying traditional medicine doesn't work. I'm saying if you want an alternative, you don't want to get blasted with chemotherapy, you don't want all the side effects, come see me and let's go over and at least find out what you need. And then if you want, we can take your test to your oncologist and ask him what he thinks, or I can treat you with low-dose chemo. I don't use standard-dose chemo.
What integrative therapies are used at the Silver Cancer Institute?
Most of the therapies are from around the world. We use therapies aimed at killing the cancer. So we use ozone intravenously. I'm under an FDA study. We use ultraviolet blood irradiation, and on the testing, we use whatever works.
And this affects, obviously, millions of Americans, millions of people. If they don't have cancer, they probably know someone who does. You have a special offer for our viewers. Tell me about that.
Yes, for the first 20 callers, I'm offering $100 off the initial consultation.
And all they have to do is head to your website, and people will be there to help them out?
Yes. We have registered nurses in the office, and they'd be glad to talk to anybody interested and explain some of these concepts and what we do.
A lot of groundbreaking information. Doctor, thanks so much for coming in and sharing it with us.
Thank you.
And if you would like to learn more information about Silver Institute for Life Extension Medicine, head to their website, silvercancerinstitute.com, or call the number you see on your screen.